Community leaders are sounding the alarm after another major hospital closure has been announced. UPMC is closing the labor and maternity unit at their hospital in Coudersport in April. This move will leave expected mothers in a maternity care desert with little to no access to providers. Our Olivia Bosser explains how it could have a ripple effect on the entire region.
You're going to put mothers and babies, their lives, in jeopardy.
Another hospital turning away expecting moms and their unborn babies, with UPMC Cole announcing it will shut down its labor and delivery unit on April 7th. It's a move that has community members questioning UPMC's motive and mission.
I find it very hard to swallow the fact that you have a nonprofit organization like UPMC making decisions based on dollars and cents. You're either nonprofit or you're for-profit. And UPMC has a ton of tax breaks.
In his 2025 budget address, Governor Shapiro outlined measures he'd like to take to bolster healthcare access in rural Pennsylvania. But residents have concerns, as previous programs to help prevent this exact situation has still left too many women with nowhere to turn.
They also recently had the governor award them $1.2 million to study this exact issue, birthing in rural areas. And they accept that money down in Lock Haven the end of January, and before the end of February, they're closing another birthing center. That, to me, it's unacceptable on so many levels, including the state of Pennsylvania continuing to fund them for that study.
Now the women of Elk, Cameron, McKean, Clarion, Clinton, Potter, and Forest counties are all without a birthing hospital in a maternity care desert. And emergency responders are already spread thin, with the closest option being over an hour away in DuBois, Wellsboro, and over the state line in New York.
Right now we run one full crew for 24 hours. We do have people that will respond for a second call, but that's not always a guarantee.
Since the closure of labor and delivery at Penn Highlands St. Mary's last year, 2 babies were born on the side of the road on the long trip from St. Mary's to the next closest birthing hospital in DuBois with the help of EMS.
We are properly trained. There's been a lot of retraining on child delivery.
But no one with the Cameron County Ambulance Services has ever delivered a baby.
We have all the necessary equipment, but we don't always have the necessary hands.
Those extra hands will have to come from neighboring ambulance services, with Cameron County only having 2 crews to respond to every call for nearly 400 square miles.
We are a BLS service, that is basic life support. If something would go wrong, we require to have an ALS service called to intercept with us, and that would be St. Mary's, which is a 20-minute drive for them to be able to intercept with us.
But if help doesn't arrive in time and they're left to only one set of hands, they may have to make the difficult decision to render aid to mom or baby.
I don't think any ambulance person wants to be put in a situation where they have to decide on who to save, what call to take, because then, they're forced to play God. Nobody wants to have to make that decision.
Medical professionals are also worried the distance or the fear of a long-distance ambulance bill will leave moms trying to do it on their own, putting their lives at risk.
Not every pregnancy is normal, and things could go bad. And I worry that, there's going to be more home deliveries, more deliveries on the side of the road, and if there's a complication, it's probably not going to end well.
The lack of accessible health care is causing young couples to put the brakes on the moving truck. And business leaders fear it will deter young families from moving in, devastating their economy.
I have heard from different younger couples that live here now that also are considering, and now it's making them pause. Do they do it? Do they stay here? Do they look for other jobs? Do they move closer to DuBois?
And for young couples that decide to move away from the area, there are some very important people that get left behind. grandparents. Solak, a mother of 2 daughters, has mixed emotions about if she'd want them planning their family in Cameron County.
I would want them here because it's close, it's safe, it's wonderful. But if they were still thinking of having children, that would be an in-depth conversation that would have to be held. Absolutely.
As does Hammersley, mother of 4.
I love our area. I think it's a wonderful, wonderful community to raise a family and children. But at the same time, I do know that it's going to be a concern, because when they want to have children and they want to get the best care, you know, they're going to be forced to probably go towards Du Bois.
This community is begging UPMC to reconsider, but for now is bracing for what they told me feels like a tunnel with no light at the end. In Emporium, Olivia Bosser, WTAJ News.